That's simply when your immune system is, a bit under. Poor nutrition, oral contraceptive pills. Some people say it's an associated factor, but there's a school of thought that says a woman who uses oral contraceptive pills over a long period of time is more likely to be a more sexually active woman. It's a theory. Does it make sense? Yeah, there are married women who use pills as their contraception, right? Is there anybody who uses that? Nobody wants to say no. There's no problem with it. But I think maybe in the Western world, a lot of women are just on pills from when they are teenagers because they can meet a man anytime and sleep and they want to protect themselves. So the theory says it's the contraceptive pills that makes the risk higher, or the fact that anybody who uses this over a long period of time maybe has a risky lifestyle. Whichever way, that is an associated factor. Please, next slide. Thank you. All right. Another thing is risky health habits such as smoking, multiple sexual partners. People make a lot of noise about this smoking that it actually increases, some say maybe a threefold risk to developing cervical cancer when a woman smokes and then is exposed to the virus. Lack of access to screening facilities. I want to say that here we still have a high incidence of many kinds of diseases, including cervical cancer. But abroad, the incidence is very, very low. In fact, particularly for cervical cancer, because there's screening everywhere. So that is why it is named as one of the factors that aid progression. Because abroad, you would have been picked. If you go and have your baby, they send you a message after a year, after so on, so come and have this. So you can't miss it, because cervical cancer is one cancer that when it is screened, it can be prevented, because it starts as a pre-cancer, yes. So lack of access to screening facilities, genetic links, less than 1% of cases. There might be something in the genes that makes somebody a bit more, susceptible, like having a first degree biological relative, a first degree means your mother, first degree direct. All right, next slide, please. Okay, risk factors. Majority of infections result from sexual contact, though a few cases of human papillomavirus may be transmitted via non-sexual routes. Risk factors include early sexual exposure. That's another thing. When a girl, someone who attains what we call koitaki, that's first sexual exposure at 14, is more likely to come down with cervical cancer than maybe somebody who was exposed at 22. Possibly the age reduces, maybe there's something, a link with immunity there, but also by the time someone starts early, she has a longer time to be exposed to it, right? Now, multiple sexual partners. This is the main she has to have it checked. Vaginal discomfort, people just feel they don't even know how they are feeling, but that area is just not okay. Offensive vaginal discharge. Offensive, usually, if I'm not mistaken, this is usually towards the later stage. It is a terrible, terrible smell. You can identify it from a mile away, especially health personnel. It's not pleasant at all. Difficult or painful urination, and then abnormal screening results in a society where before it even starts, you're already screening yourself. Next, please. The cancer spreads along the surfaces of the cervix and upwards into the womb and to the side, that's the pelvic wall. It can also it can invade surrounding structures. That's typical of any kind of cancer. Any kind of cancer will invade surrounding structures. So the surrounding structures in this case, you have the bladder, the rectum. Related symptoms will include blood in urine, constipation, blockage of the drainage of the kidneys, and so on and so forth. And when the cervix is examined, there will be an abnormal appearance, what we call ulcerations, erosions, so many things that you would see and know that this cervix isn't healthy. Next, please. Okay, so you have what we call the precancer lesions. We call them cervical intraepithelial neoplasia. It just means that area, the cells have begun to become abnormal. To just put it simply, it's not cancer outright, but there's something not right there. And the beautiful thing about cervical cancer, at that stage, you can have it, you can treat it, and it can go without becoming. So you can imagine the difference between that and someone living it and then dying of something she should have prevented. So you have the stage 1, stage 2. By the time it becomes the stage 3, they call it carcinoma in situ. That means almost as if it is almost progressing to a cancer. But you can still do something about it at that stage. Next, please. And then you have the stages of, cancer of the cervix. We won't go into that, but you have 4 stages. And that is when you have outright cancer. It can still be treated, please mind you, even when it is real cancer, not just pre-cancer. It can be treated, but of course, the earlier the stage, the better the possibility of surviving it. Next, please. Okay, to diagnose cervical cancer, screening is very important. Like what we want to do now. What is screening? Can anybody just tell me what screening is? In very simple words, there's no. Yes, ma'am, please.
Sometimes people pass there.
Okay, yes, okay. Thank you. Now, screening generally, like she said, pap smear is a type of cervical cancer screening. Screening is not necessarily done when you feel you have something. It is a testing a healthy population for a disease that they are at risk of having. A healthy population of women who have no complaints should screen themselves because these cancers, they can be silent, like we said. You may not know, so it's good to screen. Visual inspection with acetic acid is the method that we're going to use, like she has explained. You just look at it, we use some reagents, check the cervix. There are changes, you will see if there's any abnormality, and then you can have your results instantly. I will talk to you more about that. Pap smear, there are other more, complicated tests, colposcopy, biopsy. That's when we start. We're actually either suspecting or working towards diagnosing an outright cancer. Next, please. The treatments, there's treatment for any kind of cancer. I hope you know that. It's just that pap smear done every 3 years. You don't have to do it every year unless you have a high risk, which we'll talk about. Cervical cancer screening should begin at age 21 years. That's the recommended guideline by the American Association of Gynecologists. Women aged 30 to 65 years should have co-testing with a VIA or pap smear and HPV testing every 5 years, or a VIA or pap smear every 3 years. Now, I just said that women between 30 and 65 years should have 2 tests done, ideally, every 5 years. That's testing for the human papillomavirus itself, and then doing this VIA or the VLI or the pap smear every 5 years. But if that can't be achieved, having a pap smear or VIA every 3 years is also, recommended. Next. Okay, women who have had, please listen, because if one has had a total hysterectomy, that's removal of the womb for different reasons. Some people have terrible fibroid, some people have had one reason or the other to remove the womb. Women who have had a total hysterectomy and have never had a staging of whether early cancer or actual cancer should discontinue screening. Otherwise, if they have a history, let me give you an example. A woman in her 20s finds out that she has CIN 1 or 2, that's why CIN 2 or 3, what we talked about, the precancer stage. And then it's treated, it goes. But then maybe at the age of 30, she has, for one reason or the other, she has to have a